Okay, today I will make a presentation about over-the-counter topical anesthetics which can be used for managing neuropathic pain. Topical medications have active components mixed with vehicles which transport these active components through the skin and to wherever you want the active components to get to. Vehicles are divided into the following categories: powders, poultices, ointments, pastes, liquids, shake lotions, and aerosols. Initially, I was going to compare the efficacy of the active components mixed with different vehicles. However, unfortunately, I was not able to find a good article to make a presentation, so I decided to go with Plan B. In our clinic, we commonly advise the patient to go to local pharmacy store and buy topical anesthetics, 20% benzocaine, for managing their neuropathic pain. It is easy and inexpensive, but very effective in managing localized peripheral neuropathy. However, when you only tell the patient to get topical anesthetic or 20% benzocaine, what they will find in the pharmacy store is at least 5 or 6 different products with exactly the same active ingredient, 20% benzocaine. I always thought they are all the same and it doesn't matter which product they buy. However, there was one patient who told me that applying these medications stings and aggravate their pain. I thought that was silly and impossible. How could topical anesthetic possibly cause stinging pain? So I went to the pharmacy store and bought what I could find in that store. Well, they all range from $7 to $10, which is pretty cheap compared to the systemic medications for neuropathic pain. So I bought 4 of them and I tried all of them in my mouth. I was very surprised to find out that they sting. It gave me the tingling sensation instantly after the application. What I found out was that in 3 out of 4 topical anesthetics I bought, they contained inactive ingredients which are capable of causing stinging sensations. Orofacial cream contained menthol. Canca contained benzyl alcohol. And Orofacial gel contained benzalkonium chloride. And it was only the Orabase from Colgate which did not have these inactive ingredients and which did not sting my mouth. In management of neuropathic pain, you want to avoid stimulation of the associated area as much as possible. So you don't want these stinging inactive ingredients. Most of these products are manufactured for alleviating pain of aphthous ulcers and not neuropathic pain. These inactive ingredients are mostly antiseptic, so it may be good for aphthous ulcers, but what we're trying to do is to desensitize the nerve. In my opinion, Orabase from Colgate is the optimum product for managing neuropathic pain at this point. There is another product called Canca Soft Brush. The other Canca product contained benzyl alcohol, but this seemed not to have anything written in the back for inactive ingredient. Unfortunately, I was not able to find this in the pharmacy store, but this is something I would like to try as an alternative. If it doesn't contain any of these inactive ingredients, that's great. This is a little more expensive compared to Orabase, but it comes in a form of a brush, which makes patient easier to apply to a focal spot or region where they want to put it on. So that is it for this presentation, and thank you very much for your attention.